These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of, you and I, together.
It happens behind closed doors. Everybody does it. Nobody talks about it. Going to the bathroom. The whole subject of elimination is something that people don't like to discuss. Not with their closest friends, especially not on television. But not talking about it is costing lives. I'm Lila Lazarus, and this is Discover Remarkable at the Heart of Medicine, with brave patients who are willing to talk, and the doctor who wants to save their lives.
Tomorrow morning, we leave here at 5:15. Surgery's at 8. I worry about waking up and being in a lot of pain. This is a worry cross. One of my best good friends gave it to me. You just hold on to it when you're troubled or nervous or tense, and you pray, which I do a lot.
I'm Bob Cleary. I'm a colon and rectal surgeon at St. Joseph Mercy Hospital in Ann Arbor. Judy's gone through a lot. She has a tumor that causes significant symptoms, a lot of pain. It causes her to leak gas and stool, so it makes it difficult for her to go to restaurants, to go to movies, to do the things that she likes to do.
About a year and a half ago, started having little issues, intestinal every 6 months or so. Everything seemed to be okay, and I thought I came down with hemorrhoids. I'd never had hemorrhoids.
And that's a very common thing. It used to be a common thing even amongst physicians who don't see this every day to attribute anorectal complaints to hemorrhoids.
It would start off constipation and be constipated like 3-4 days. I mean, it got very painful. And then from there, I went to the other end of the spectrum, to loose as a goose.
Judy had radiation and chemotherapy for a form of cancer in the anal canal. She did need surgery, and it was in a difficult location in that it's impossible to take out this tumor without having a permanent colostomy.
So when they said it was cancer, what did you think?
That was a hard one.
Yeah, I still remember the morning when the doctor came out. I remember, we thought, okay, maybe it's just a
we went in thinking it
treatment,
was hemorrhoids
or something, and then he came out and said it was cancer and that we need to have more tests done.
The word cancer is frightening to anybody, and so she's been dealing with that since her diagnosis. And though she did have a good response to the radiation and chemotherapy, she still has a mass there, she still has pain.
I don't worry about myself. I always worry about everybody else. Make sure my husband's okay, make sure my daughter's okay. I guess it's the mom in us, You can't be afraid of it. You gotta be strong, you gotta fight it.
I couldn't have a good time. I didn't feel good enough to really enjoy myself. I was afraid to be too far away from home. It's no secret. We all go to the bathroom, and you like the security and privacy of your own. There's no way in the world I would ever have gone out to dinner and had a cup of coffee afterwards. It was back pain, it was abdominal pain, it was at times I was sweating, and then at times I would go into almost convulsive chills.
That's not an atypical history for someone with diverticulitis. They develop abdominal pain, they aren't able to eat, their bowel habits change.
I went into a local clinic, and fortunately, they did a blood test, and when the results of that blood test came back, they told me I was in serious trouble.
Soon I'm going to go meet Judy and her family and update them on the information that I have.
I got my dancing shoes on.
How you doing?
I'm doing good.
Yeah?
I'm doing good.
You all set?
I'm ready.
Yeah?
I am so ready.
Okay. Sometimes I'm meeting family members who weren't there in the office. It's important to make sure that they're well informed. We did those biopsies last week, and the biopsy showed there was no residual cancer. And if there's no cancer cells, so why are we doing this? And the reason is because there's still a mass there. And if I was to go back and just take out that mass, I'd be taking out most of the muscle that controls your bowel movements. And so your quality of life would be a lot worse than it is right now.
It's not a nice thing to discuss. It's none of it is nice to even have to go through.
I think sometimes you get used to feeling bad and you accept feeling bad and it just becomes your way of life. I'm thinking, well, it's just my lifestyle and the coffee that I drank. I shouldn't drink coffee at this time. You make excuses.
I think what's really important is having all the support that we've had, family, friends, just on down the line. It's just incredible.
Sorry, things are kind of poopy right now. Kind of poopy, yeah.
I couldn't have a sexy cancer. I couldn't have a belly button cancer or something. I gotta have the butt. You gotta keep your humor, and the humor does get you through it. Been married 37, going to be 37 years the end of this month.
Wonderful years.
Well, he likes to think that way, so we'll let him.
She's very symptomatic from it in terms of pain and leaking gas and stool. And so the good news is that because of those biopsies and her response, and because her CAT scans show that the disease isn't in her liver and lungs, this very well may be a curative operation.
I don't worry about having a permanent colostomy for the rest of my life. My eyes have been open the past month, ever since we've known now that this is my route that I'm going to take. It's adding 20 to 30 years on my life.
I'm a retired police officer, and I spent the principal part of that career as a SWAT commander and major crimes detective. I'm also an attorney. I've been an attorney for about 30 years. I get up early. I'm usually in downtown Detroit in court. By 8:30 in the morning, 8:30, 9 o'clock, I'm there. I'll spend several hours in court, appearing in front of a number of judges, and after that I then come to my business. Have you ever shot it before? Have you shot any gun before? These holsters, no matter where you put them, stay right where they're at. I'm a stickler. I put a lot of pressure on myself to make sure that I comply with all the rules and regulations as it relates to the sale of firearms. Are you right-handed?
Yep.
Okay, keep this gun pointed in that direction. I think I have a responsibility that their time here is first spent safely and then it'd be a rewarding experience. Grab this, pull it, and let it go. Guns are dangerous. This gun is now loaded. I kind of equate it to a stick of dynamite. Now, where I want you looking is right here. If somebody had a stick of dynamite, how would you want them to handle it? Put your finger on the trigger and pull the trigger slow. You better know what you're doing when you have dynamite.
What strikes me is you're such a tough guy.
I'm not a tough guy.
Yes, you are a tough guy.
I'm a soft guy. I'm sensitive. I'm fragile. Very nice.
That's awesome.
Nicely done.
Well, when they say to you, this is serious, what'd you think?
Well, I thought I'd get to the hospital and get it taken care of is what I thought. Fortunately, I have a sister who's a nurse at St. Joe's. She had a friend who's a specialist in this, and it's Dr. Cleary, and she called him on a Saturday night, and he returned her call.
You took that call in the middle of the night.
I just think that's part of life. I think that's what anyone would do under those circumstances.
You thought you were going to die that night?
I thought there was a good chance of it, yeah. That first night in the hospital, absolutely. I was that sick.
He's been through a number of difficult circumstances, and for him to be worried about himself and his health probably was a difficult thing for him to go through. This operation should improve your quality of life, and with a reasonable expectation that it will cure your cancer. Okay.
That's what I want.
Do you have any questions for me?
How soon can we start?
We're going to take good care of her, okay?
All right. She's in good hands.
All right. See you in a little bit.
Okay, thank you.
Love you.
I love you, Dad.
She's definitely in good hands, so that's a good feeling. It really is. You know, I mean, you know, things could still go wrong, but you know, you just got to be optimistic and just hope for the best.
We got a lot going on with 6 kids, and Molly and I have a lot going on. Somehow I got home 6 times during the course of my residency and early years as a staff surgeon. So they loaded up the truck and they moved to Beverly Hills, that is. Yeah. Come on, Megs. When I come home, it should be all about them and what's going on with dance or piano or baseball or whatever it is going on that day. Baseball was a big part of my life growing up, and my boys have all been baseball players also, and I had the opportunity to coach them earlier on in their careers.
When he was like 17, I think, he threw 91 miles an hour.
He can throw a 91-mile-an-hour fastball?
Yeah, back then radar guns weren't as popular, but he told me he got radar guns one time when he was 17 at 91, so I can't imagine what he was throwing when he was 18, 19.
So he was a star pitcher.
Yeah, he played at Notre Dame.
People don't know that you were a Notre Dame baseball superstar.
I live in Ann Arbor. I try to keep that quiet.
What else is there about you that your patients don't know?
He really likes Disney World. He loves it. And he likes the Pirates of the Caribbean ride.
When I was in college, the one way to meet girls was to teach disco dancing, and so my roommate and I got to school early, and we built a lighted floor in our dorm room.
Can you still do those disco moves?
I'm not sure. I haven't done them in a while, but it's not too far from Zumba, I don't think.
You know, from now on, your patients are going to know your disco dance teacher.
I may have to pay for that comment, yeah.
I want to know what you guys think of having your dad, first of all, as a doctor, and then the kind of doctor that he is.
You get a lot of jokes.
Really?
Yeah, that's good. He's the butt doctor.
I remind them that I operate in the belly, too.
No, it's pretty awesome, though, in all seriousness. Jokes aside, he's the man.
I know people who have come up to me and been like, your dad helped my family. They helped us get through this hard time, and it's inspirational.
He is one of the most hardworking and well-balanced men I know.
He goes in extra early just to finish his rounds early, just so he can make everyone's games, dances, whatever's going on. So it's really nice.
How would you describe your family?
Close, tight-knit, close. We're there for each other. Yeah, it's as much, and I was raised in a family like that, and I feel fortunate to have a family like that, to be raising one. We like an active house, and yeah, in fact, we only have 3 in the house when they've gone to school, and that's too quiet.
And that's why I got the 3rd dog. My neighbor says every time a kid goes to school, Molly gets another dog.
Got up at 4:30, showered, got dressed, came to the hospital. It's become part of my life. I'm devoted to resident education and research, and there comes a time where that has to be done, and carving that time out in the morning has been what I've become accustomed to. It allows me to do my reading and work on the research projects that I have going. It also allows me to get out a little earlier at the end of the day so I can spend time with my family. Well, as a baseball player, you have to get your mind ready for a game, and that's part of what we do in the morning, is get ourselves ready to be mentally focused and mentally sharp to allow the best operation possible.
Should I use the standard spread technique?
Oh, just do whatever you normally do. We have surgeons from all over the country who are interested in setting up robotic centers themselves, and so they want to see how it's done, and they come in for what are called case observations. As a laparoscopic surgeon, this is going to be an easier transition for you, and by number 3 I was never looking back, because this is like laparoscopic surgery, except it's a better imaging system. You can use a 3rd arm. The camera goes where you want to go, and it doesn't jiggle no matter how much coffee you drink, because it's under your control at the console. You don't have an assistant, and because the movements are human and wristed, they're more precise. One thing I think you'll come out with robotic surgery is you feel like it's a more precise operation than the other options. What service you on, Tom?
I'm blue.
Blue, how's that going?
Good.
How many people can do the surgery you're about to do today?
Not too many, because the learning curve is so high. The colon and rectum is more than 1 quadrant in the abdomen, and so minimally invasive surgery, whether laparoscopic or robotic, is a difficult surgery to learn. There are probably some hand-eye coordination things in baseball that benefited me as a colorectal surgeon. What was to my benefit more than anything was playing a team sport. I don't think team sports are overestimated in the value they have in a profession like surgery. We'll put a Da Vinci port here, a Da Vinci port here, and Laura, how about right there? We have an outstanding group at St. Joe's in the operating room. The Da Vinci nursing team is terrific and significantly contributes to patient outcomes. With Bill, it's not cancer, but it's still impacts quality of life, and it's still potentially life-threatening if it gets out of hand.
What I had heard from other doctors prior to seeing Dr. Cleary is that I needed surgery immediately. When I saw Dr. Cleary, it was just the opposite.
Often with people with diverticulitis, you don't talk them into surgery. You talk about what surgery is about, what the options other than surgery are, and help them make an informed decision as to what the best option is going to be for them. And it's not always surgery.
That became very difficult because then anytime I started feeling any discomfort, I thought I was having a flare-up. And then you start speculating, well, geez, if this continues throughout the night, I could be dead by morning. So I went back to Dr. Cleary and I said, I'm tired of feeling this way, and I'm tired of living with this hanging over my head. He says, then it's time for surgery.
Yep, I'll take that harmonic anytime you're ready. Know what I'm saying?
He has a great sense of humor. You just sort of never know what he's going to say, but it always brings a smile to everyone's face.
Molly was working with us. She just recently went to the nursing float pool. She's a lot of fun, and she just brings that part of the fact that we know doctors have regular lives and kids that go to practices and they go grocery shopping, and they're just normal people too.
She's has some oozing, some bleeding, not prohibitive bleeding, but a little bit more than we want at this point. So it's going to be a little longer than we expected, but we're heading in the right direction.
All you do is wait and pray, that's all. You know it's going to come out all right, you know. But it's up to the man upstairs.
And the first part of the operation went really well, so they haven't been big roadblocks, but issues that you contend with as a surgeon. All right, Juanita, looking good. Keep going straight, keep going straight. Good, straight ahead. Looking good in the neighborhood.
Does it ever blow your mind that you're using a robot?
Just 5 years ago, I wouldn't imagine that this was possible. I'd have laughed if someone told me this is the way I was going to do it. We used the robot for the surgery, and so she had small incisions on her abdomen. That's how we do the robot surgery, and the specimen taken out through a small incision. See, those heart doctors, they're lucky. They just operate in one quadrant. And us colon doctors, we have to be versatile.
How does having 6 children make you a better doctor?
That means I have 7 people telling me what to do, so I have a lot of direction. In the operating room, we play music, and so I know the music that my kids are playing too, and the residents can't believe that a 54-year-old man would know who T-Pain is, but I do, and Lil Wayne is one of my favorites.
Lil Wayne, huh?
Yeah, I'm so glad he's out of jail.
He likes to keep up with the age, as well as hold on to everything he knows. So me and him will jam to the oldies together, and then he will be listening to Lil Wayne and bobbing his head in his car. And he knows how to be hip and cool without being embarrassing.
Did it. Thank you.
How'd it go?
Good.
How do you think it'll be for her?
I think she's going to do well. You can never foresee complications. We worry about them, however infrequent they are. Assuming no surprises, I expect her to do very well. We did a cancer resection to include good margins, both the intestinal margins and the lymph nodes, in someone who has local disease that hasn't spread anywhere. So it was an operation for cure. Hi.
Hi.
She did fine. Everything went well. I feel like we accomplished what we hoped to accomplish, and that her quality of life is going to be improved as a result of this operation, and that's what we're here for. She has a terrific attitude, and she's got a great husband. She's got a lot of family support, and that helps in a big way.
First of all, I need to put the rings back on, and I promised her that when I do, I'm going to have to correct something I didn't do 37 years ago. And that was to ask her to marry me.
So last I saw you, you were in surgery.
Mm-hmm.
And here you are, 13 pounds heavier.
Yes, yes.
How do you feel?
Feels good. I feel healthier.
He finally proposed.
Oh.
Tell me how it went.
Well, my memory's kind of foggy.
So is mine.
I do know that it took 37 years to finally just say, hey, do you think you'd want to marry me? It's like, it couldn't have been that hard, you know.
I promised her that someday I'd propose to her, so I figured that was the opportune time.
And I'd do it all over again.
Hello.
Dr. Cleary, how you doing?
Good, how are you?
Good, good to see you.
Good to see
How's
you.
everything?
Oh, can't complain.
Great.
Feeling okay?
You know what, I'm feeling pretty good. 100 years ago, I would have been dead. With technology today, not only am I feeling great, it was a pretty easy path to get there. I wasn't in the hospital for 2 and 3 weeks, and I wasn't cut from, you know, my neck to my stomach either.
Let me have you lay down there. Let's take a look. Can you pull this up for me so I can get a look? With the Da Vinci robot, we were able to make small incisions to take out his sigmoid colon. And when we do that, we take out the diseased portion through small incisions.
Piece of cake. I couldn't believe it. I mean, for the next week, you're sore, but you've been cut open, so that's to be expected. But I was on my feet the very next day. And to me, that's unheard of.
My last 3 robotic surgeries like Bill's have gone home on the 2nd day after surgery. And if you told me that 5 years ago, I'd worry about the surgeon doing it.
Thanks.
Good seeing you. See you again in a couple weeks, all
okay,
right?
thank you very
all
much.
Right.
I feel great now. And what's amazing is I think back now that I feel better now than I did even 4 or 5 years ago. I don't have the issues I had 4 or 5 years ago.
It went very well for him. We accomplished what we had hoped to accomplish with him, that is, to not have these symptoms that were keeping him from doing the things he likes to do.
Everything looks clear. We're good to go. I asked Dr. Cleary if I would be able to travel to the Catskill Mountains 5 weeks after my surgery, and he assured me I would. I had absolutely no issues. Probably the best weekend I've had in a long, long, long time.
Game over. Life with bag/pouch or colostomy, and mine is called Pete. My little
Buddy.
stoma is called Pete, and Pete and I have conversations. Some days he needs a muffler, some days he doesn't.
A vast majority of people adjust very well to having a permanent stoma.
I can't sit here and wallow because I'm going to have poop coming into a bag here and I'm going to have to go clean it. I mean, that's the reality of what it is. It's like, hey, this has given me 20, 30 more years of life. Pete has. So yeah, I'm going to be proud of it and deal with it and accept it. I can eat anything, so I'm happy.
The good news is that her prognosis is very good and it most likely is behind her. Do I need to make reservations anywhere?
No. I'll just think of someplace, you know, my favorite.
Again? 1, 2, 3. Happy birthday to you. I'm fortunate to have a really nice life. I have a great family. I've got a lot of support at home. I'm satisfied at home and I'm satisfied at work.
What's your favorite restaurant?
Lilies?
So now you're not afraid to go to Lily's?
No, I'll go every day if I want. I'm much more confident. I'm much more active. I have a lot more energy into what I do. I don't live in fear of this erupting. I don't even think about it.
I'm going to make them into tube bouquets.
Yeah,
because
there.
they're so
Yeah,
full.
there's enough there.
There's enough there. Life is good.
Good.
You know, I'm thankful for another day, every day.
What'd you think of the care you got at St. Joe?
If I get sick again, I'll crawl there if I have to, because that's where I'm going.
It is funny. We'll talk about our hearts and our lungs and our hip joints. It's time we talk about rectums and colons and getting that colonoscopy by age 50. Not really something I want to talk about at a baseball game, but talking about it and getting to the right doctor, that's what saved Judy's life, and Williams. That's Discover Remarkable at the Heart of Medicine. I'm Lila Lazarus. Thanks for watching. We'll see you next time.